Rotate. Oh. I don't know if it's easier, but we can turn off one of the lights too. I was pretty. Oh yeah, that's easier to see. All right, you good? There's plenty. There's even one with cereal on it, so it's kind of
there is.
Send it to us. Oh, right. Yep. Okay.
Excuse me, is there any way to fix the angle of the camera that we are viewing over the Zoom? Actually, the screen is
kind of
split.
this corner. I'm not sure how to fix that.
Oh, yeah, you can move it. You have to do
I think
like
it's I think
little
it's split off of this camera and
I'll try. Unless you stand on that side, I think then they can see you. That might be the solution. Tassim, how's it now? Can you see Rochelle?
yes.
Actually, the thing that we are seeing here is split between the doors and between the, so we can see I would say 2/3 of the screen, but not the entire screen. I don't know whether it's possible to
Can you see the
focus on the screen.
presentation?
I can see you, yep, and I can see the board, and I can see lots of the doors.
But not the presentation.
Yeah, you have to share the screen.
Okay.
Yeah.
There you go. There we go.
Yep, much better.
Perfect. Cool.
Thank you.
Thank you.
All right, great. We're all set now. All right, good morning, everyone. I'm Rochelle McCarthy with AON. I assist Joanne and Hope with your student health insurance program, and also work closely with UnitedHealthcare Student Resources. And Larita is on the phone. Larita, you want to go ahead and introduce yourself?
Sure. My name is Larita Dixon. I am working with Alec Dollard, who is the account executive over the account. So I'll be the day-to-day go-to person as far as if you have any questions or scheduling any meetings with regards to it. And I am the client service analyst for this account.
Great, thanks, Larita. So for today, we're going to walk through some health insurance basics. So how does health insurance work? Who is eligible? The student representative submitted some questions around medical, your dental and vision, and just general plan questions. Larita and I will be assisting you in responding to those questions. Then we're gonna go through some scenarios on how your insurance and your plan actually works with deductibles, co-insurance, and out-of-pocket maximums. We'll walk through the benefit summary, and then some other important key health care terms are in the back for your reference. So health insurance basics. How does your health insurance work? Your insurance is in place with UnitedHealthcare Student Resources to help with the cost of unexpected injuries and illnesses. It covers certain percentage of expenses when you go to the doctor or the hospital. And then your co-insurance is what you are responsible for paying that insurance doesn't cover. If you don't go to a hospital or doctor at all during your time that you're covered, you are not refunded for any of the premiums that you paid during that period. Eligibility for the student health insurance is all international and graduate students. Undergrad domestic students are not mandated to have health insurance, but you may utilize the student health insurance program. If you're not insured under the student health plan, you must have other comparable health insurance through your parents or some other individual plan. Any questions before we jump into the questions that the students submitted?
Yeah, sorry, I just need a clarification on the co-insurance. You said that's what we pay? I'm
Yes,
asking because mine says co-insurance preferred provider is 80%.
yes.
Does that mean I pay 80% of the cost for
You
it?
pay 20%, and we're gonna go through a scenario that shows you how that's broken down. Okay, some medical plan questions that the students submitted. So first question was, what is the preventative care coverage? Regular checkups, immunizations, year lab work fully covered, or is there a copay? The response is your policy will consider benefits for preventative care charges that meet the guidelines. Routine care does not meet preventative care guidelines would be denied.
This is a very tricky part here, actually. I did have questions about the preventive care. So three of my friends, they went for the preventive care in this year under the United Health Insurance, and two of them, all of them, they did the annual preventive care checkup. Two of them, they needed to pay around $1,000 out of their pocket. And I know at least one of them, it was a very hard time for them. And I know another of my friend, he did also the preventive care checkup, and he paid the $30. So my question is, what is the preventive care guidelines that you are talking about? If, for example, if I go to do the preventive care for like annual checkup, do I need to? How can I skip that $1,000 bill and pay $30?
Larita, you want to answer that?
I'm sorry. So for the basic preventive care guidelines, we do have a link on the the healthcare.gov preventive care benefits. There is a link that will take you through all of the preventive care guidelines that we actually do cover. Anything that's outside of those guidelines, it will let you know if I'm sorry, the site will also let you know the out of network providers as well. So before you actually build, you can speak with that healthcare provider to see is this or if this is not covered as preventive care, and also our customer service department can help with those as well. So it's in the summary brochure and also inside their certificate with the list of all of the covered preventive care.
Well, thank you so much for your kind answer. Yeah, what you're saying it's true. But there are some things. For example, the friends of mine. I am only talking about three, but I know there might be other students also who had that problem last time. So here's the thing is that all of them, they didn't go for like a CT scan or something like that. They just went for the cholesterol checkup or something, like very necessary things for us to do. And they were billed $1,000. And here's the tricky part about the customer care service. One of my friends, he's also a PhD student at Michigan Tech, and he's my office mate actually. When he called them, when he called in the customer care, they were saying that no, you need to pay for your annual checkup. You need to pay for your annual checkup. It was I don't know what to say here. So is the plan changed this time, or is the same plan is continuing from the last time and this time?
The plan is not changing from the last time to this time. The plan is still the same.
That means we are in a risk to pay for the cholesterol check, for example, annual test, to pay $1,000 for the annual checkup.
Not necessarily at a risk themselves. It's actually depends on the healthcare provider itself. And
The
as far as
healthcare
the
providers is
preventive,
in network, not out of network. The Portage Healthcare, they are in network, that's as far as I know. Yep.
okay, so for the general preventative care guidelines, if you're going to do like an annual checkup or breast exam, those are the general preventative care guidelines. Anything outside of that, um, uh, it's kind of a little tricky. That's something that the customer service department can explore in depth as far as explaining what's not covered as far as the preventive care. And in the summary brochure, I'm sorry, on the link itself, it'll give you everything that is covered and everything that's not considered to be preventive care.
Okay. Okay. Yeah. Okay. So that means the summary of my question is that I need to talk with the customer care service before going to visit the doctor, and then to listen what their recommendation, like if I want to do the cholesterol checkup for annual checking or something, if it's covered or not. Um, this is the answer, right?
Yes, before just like receiving any type of like major bill or if you had any concerns about it.
Okay. Yeah, thank you.
Mhm.
And you could always follow up with your provider in advance of your appointment, just to confirm if it's a preventative visit as well.
Okay, thank you.
The next question is, what is covered in the plan regarding OB, prenatal, maternity care? How much should I expect to pay? So that would be considered the same as any other sickness or illness. Benefits are administered based on the services that are rendered. Maternity labs would be considered under the laboratory benefits. If the provider bills for prenatal care and delivery as a global charge, the prenatal portion of the charge will be considered preventative, while the delivery will be considered under the surgery benefit. Next question, what are dependent premiums and what is the reimbursement policy? Who can enroll as a dependent? Dependent premiums are listed there. Eligible dependents are the student's legal spouse or domestic partner and dependent children under 26 years of age. And then I also have a handout here that gives you all of the premiums by coverage periods.
Can I speak to the reimbursement portion of that?
Yes,
from a
go ahead.
university perspective? If you are a supported student, meaning that the university pays for your health insurance plan, you can submit a reimbursement for any dependents and receive 50% refund on that. And you just contact student insurance to do that.
Perfect. Next question, what is changing in this year's plan? Is there any difference in coverage or expenses? There are no changes to the plan from last year. All coverages remain the same. The premiums are the only change to your rates. I have a condition that requires a specialist that is not available in network in the area. Can I get approval for an out-of-network provider in the area, or is there any reimbursement for travel to an in-network provider? There's no provision under the policy for an out-of-network provider or at the preferred provider level, unless it's due to a medical emergency, and there are no benefits for travel to an in-network provider. How can I know ahead of time what I will be expected to pay for a specific service? So UnitedHealthcare Student Resources does have a cost estimator tool, and I provided a printout of that tool and how to access that. As well as on the website, there is a video called How to Find a Provider and Cost Estimator at this link, and you can also reach out to customer service. What are the dates of coverage? Annual effective date is August 16th through August 15th of 2024. And I do have a handout that describes all the other coverages in those periods. How does billing work? A copay, bill timeline, expected cost. An in-network provider would submit the claim to UnitedHealthcare Student Resources. And then the bill for the patient is balanced after processing. The provider may bill upfront at the time of your service for an established patient balance, such as a copay. An out-of-network provider should submit the claim to UnitedHealthcare and then bill for the patient after the processing. Since UnitedHealthcare does not have a contract with out-of-network providers, they may charge the entire claim amount upfront and then reimburse the insured after processing. Claims are processed within 30 days. They are received as long as no additional information is needed. Yeah.
What's the difference between in-network and out-of-network? Like, how do those things differ for a student perspective?
So in-network are providers that have contracts with UnitedHealthcare. So you get the in-network contract rates, negotiated rates with UnitedHealthcare. Out-of-network providers do not have contracts with UnitedHealthcare, although UnitedHealthcare can try to credential those providers if there's enough interest in getting that provider to come on board. Anything else, Loretta, to add to that?
No.
Does that help?
Yes.
I have a question regarding that. So I got a bill from the hospital, and at the treatment, I gave them my insurance information, and I still got the bill just like directly to me. And so I contacted UnitedHealthcare Student Resources and the hospital and kind of like arranged for the bill to like be sent directly there again. And a month later, I just got the same bill again. But there is this 3-month period in which I need to, if I pay it myself, I need to like submit it within 3 months. What happens in this case? Because like this takes time, obviously, of the time that I have. How's that handled?
Is this your final bill or is this your EOB that you received? Did it actually say a bill?
Yes, yeah, it was.
Okay.
And they didn't bill your insurance at all? And they didn't bill your insurance, it sounds like?
No, I don't
Okay.
think so. This was from Portage, so I'm guessing that they should.
Yeah, so I'm gonna speak to this just because I've had this happen to myself with an employee insurance.
Yeah.
Portage Health has gone through some changes in their billing department and they've sent everything overseas.
Mhm.
So it slowed it down tremendously.
Yeah,
So I'm not getting bills until months later
yeah,
after the service has happened. And a lot of times they haven't billed anything correctly through the hospital.
yeah.
So I would make sure through the hospital that they have actually billed your insurance on all those dates of service. So I would probably start by calling the hospital first. Just knowing what I know about Portage and what's going on right now personally.
And on your bill, you should have a line item that says insurance covered or adjusted insurance adjusted amount too. So you should see something that indicates it has gone through your insurance.
And if it doesn't, that's a hospital issue.
Yeah.
Yeah, and they need to rebill it.
They're not billing it correctly.
Thanks.
Hello, may I have a question?
Sure.
My question is that is this actually insurance plan that the university provide for the fully funded students? Does it cover the injuries which happens to the collisions? I mean, if the students be driver and some injury happens to the accident, does this insurance cover the I mean, can we use that for the for this purpose or not?
If you get in a car accident.
Is that, I thought that's what, yeah. So Loretta, did you catch that?
I'm sorry, can you repeat that?
I think it was if you're in a car accident,
And you get an injury.
and you have an injury, are you covered, right? Through, it just goes through normal.
Yeah, yes,
Your car isn't covered though.
No, the car is covered, right?
no,
But yeah, everything would get submitted under a normal injury
Thank you very much.
Okay. Next question, are specialty medications covered under the plan? Are they handled through a third-party specialty pharmacy? For this, you would need to refer to the prescription drugs benefits in the schedule of benefits, which is a lengthy handout. Or you can contact UnitedHealthcare customer service as well. Many states have quarterly and monthly updates posted to the school's website. So you could be directed to one of the school's pages on UnitedHealthcare. That'll provide you more RX updates. Anything else here, Larita, you can add?
No.
Are there waiting periods for covered items? There are no waiting periods for any benefit under the current policy. I sprained my ankle. Will the medical insurance cover this? So covered medical expenses incurred as a result of an injury that occurred prior to the policy's effective will be considered a sickness under the policy. Services rendered by a preferred in-network provider are considered 80% covered after you pay the $150 deductible. And services rendered by an out-of-network provider would be considered 60% covered after a $300 deductible. So you would pay $300 first, and then all other remaining covered amount would be covered at 60%. Having hormonal imbalances like acne, hair fall, anxiety, feeling sick. If I go to the doctor, will everything be covered? Claims are processed based on the information submitted by the provider. So if the claim is submitted with a diagnosis of acne or hair loss, then the charges would be denied as acne and hair loss are excluded under the policy. Anxiety would be considered under mental health benefits. A claim if a member is feeling sick with a covered diagnosis would be considered under the policy. But UnitedHealthcare cannot confirm everything would be covered until the actual claim is submitted and processed through the claim processing area. Is the basic annual checkup fully covered under preventive care, such as blood tests for checking levels of cholesterol and sugar and vitamin D? Annual checkups that meet the guidelines will be considered under the policy. Blood testing that is part of the annual check will be considered preventative. So if you're getting a cholesterol screening, that would be considered for ages 40 to 75 when billed with the appropriate diagnosis. Cholesterol blood testing for an insured that is not 40 to 75 years of age would be denied under the routine exclusion. And vitamin D testing is not part of the preventative care guidelines and would fall under the routine exclusion. Diabetes screening blood tests would only be considered for pregnancy diagnosis.
Excuse me, to interrupt again. So here's the answer of my question. So that means aged 40 to 75 only they have those some kind of like the insurance for the basic annual checkup, but for like anyone who is not 40 or under 40, they will not have that. Lots of things they will not have been covered for the annual checkup. So basically, I'm sorry for my interruption again, but so basically that means this health insurance is for the students, and most likely I would say I know there are also students aged 40, then more than 40, but maximum they are less than 40. So that means for the annual checkup, most of them they need to pay for those basic blood tests and everything. I don't know how to explain this.
So, Rita, would like basic blood work be covered as an annual checkup under the student plan?
It's covered if it's 40 to 75, it's written there. And it's actually true because two of my friends, they needed to pay those $1,000 for the annual checkup. And the students, most of the students are under 40 years old. So how this annual checkup is connected to the student health insurance, it doesn't make any sense to me. I'm sorry to say this, but it's the truth. At the end, if I need to do the annual checkup, I need to pay from out of my pocket, even though I have the health insurance.
So can I speak to that from another personal perspective?
Sure, go ahead,
So,
Joanne.
I always compare it to myself because I have a similar situation to him, right? So like, I went to the doctor and I said, I'm here for my preventative visit. My doctor ordered additional blood work that wasn't covered, what was considered preventative under my plan for my employment policy. However, she said, you need this in particular, okay? So I got my thyroid checked and I got some other things checked, which were not considered preventative under my plan. And I paid hundreds of dollars for it because she ordered it. So next time, this is what I've learned, next time I'm going to say, what kinds of things are my doctor going to order when I'm there? And then I will check with my insurance plan and I will give them the code to find out whether or not it's covered. Just as a learning experience, I learned that this year too.
But I guess, and Loretta, maybe you can answer this, wouldn't that be considered medically necessary or a medical necessity under?
The preventive cares are they have been defined in such a way that those are the basic kind of checkups that everyone needs to do. I'm totally agree with her experience because sometimes individual patients, they need something to check, but that's not under the preventive care. I know I dig up the soil and I've learned lots of things about those tricky insurance definitions, but preventive care is such, for example, it's a common thing that everyone should need to have this tested to become healthy, to be healthy or something like that. And especially the students, especially the graduate students and the international students, these are for the insurance, and also the undergrad students, they go through lots of stress and lots of problems. So it's crucial for them to to have at least 2 checkups, to preventive care checkups, not the thing that's necessary for them, but in general. But looks like in here we have we need to pay from our pockets to do most of the preventive care checkups. Thank you.
I maybe, Loretta, wouldn't annual physical exams with regular blood testing be covered for students?
With regular blood testing, anything that the doctor orders as a specialty would be outside of that.
There's not sorry to interrupt again, I'm very sorry, but it's not specific. It's the preventive care guideline. All the doctors, they have a tablet, and in the tablet they have the recommendation for the preventive care testing and everything, and then they go through the preventive care options. It's not the specialty, because I've told you, 2 of my friends, they are different individuals, and they need to pay all by the same. They were not here today, but if they were, I wish they would hear and they would explain more. But then they say what's it's written here is for the aged person, like 40 to 75 years old, then they covered, but not for us, not for the students.
Yes, and we'd also need to make sure that the doctor's not billing for something else. So as long as it's within that preventative care guidelines that the doctor is billing for, and it's getting over to our claims department, and it is up under those preventive care guidelines and nothing outside of that, then it would be covered.
So
not that the doctor's billing under any type of a sickness or anything. So just as a preventive care, like
I'm sorry, I totally understand. I know that thing. If you're sick and they give the test, they will not cover. But those people that I'm talking about, they didn't go there for sickness. They did go there for their well-being checkup. And they were billed for the preventive care test, like the blood test, they needed to pay all of those things from their pocket. So this was actually my first question, but now I know you answered that we need to go through the customer care service and then ask them whether it's covered. But we know that the blood testing will not be covered. And again, I'm not saying that this is for the illness; it's for the well-being checkup.
Yeah, and that should be covered no matter
Yeah.
based on an age, because
It
that's,
is written here, cholesterol blood testing for an insured that is not 40 to 75
yeah,
would be denied under the routine exclusion.
your annual regular checkup should be covered. If it's coded as a annual checkup and not, like Loretta said, nothing else.
Okay, thank you.
I would definitely go back to customer care and look into that.
Thank you.
Particularly for Michigan Upper Peninsula, which general services are covered under the insurance plan and which clinics cover these services. So the benefits are the same in the Michigan Upper Peninsula under the policy as any other location. Anything else on medical before we move on to dental and vision? Okay. Dental and vision. How do I sign up for dental and vision add-on? Also with the add-on, which dentists are covered in this area. So the voluntary dental and vision is changing from SureBridge to U01 for 23-24. There are links on the website for students to visit. Here's the link to that website for additional information. And then I also have some flyers on that as well, printed out. Loretta, would you like to speak to the new platform?
I do have one of our ancillary manager, Sean Dugenhart, on the line. Sean, did you want to help explain a little more?
Hi, sure. Happy to. So, like Loretta said, my name is Sean Dagenhart. My team manages the ancillary products, which includes the dental and vision. We did move away from SureBridge for this upcoming policy year to UH1. They are a sister UnitedHealthcare company, so we're happy to have them available to our students. They're going to be using the UnitedHealthcare networks, which we believe are stronger than the SureBridge network. So you'll have more providers accessible to you under these plans, and that's kind of why we decided to change. Like it mentions here, you can sign up anytime during the year. There's no open enrollment period, so come January or February and you need dental vision, you can pop over to the website and enter in your demographic information. It will give you a quote. So you can review the plans available and decide which one best meets your needs and then sign up right there on the site. You can be effective as early as the following business day. So it's very flexible to meet your needs. And then you'll just keep paying a monthly premium. You'll have the coverage as long as you keep paying the premium. And they're like she said, there are flyers and other information available on the site that you can learn about the different plans and benefits.
Thanks, Sean. Are there any plans that would provide more comprehensive coverage? I know it indicates that there are no plans that cover actual dental surgery. So are they more just basic dental coverage and vision coverage?
We actually have a range. We kind of did a high, medium, low. So if you're just looking like basic, need my teeth cleaned once a year, maybe get a filling here and there, we do have a very basic plan available. And then we've got a couple plans that do include major coverage, major services. So if you think you're going to need more high-level dental care, you can explore those options on the website. There are a couple that do have major care included.
Any questions around the dental insurance? Thanks, Sean.
Okay, no problem.
So some additional dental questions. I have a sensitive tooth. It will cost at least 500 for the x-ray and checkup. I think university health insurance should cover the dental costs. So this was a question that we needed some additional clarification around. We weren't quite sure what the ask was here. I'm not sure who posed this question. All right, next question. My son needs a dental surgery and both medical and dental insurance does not cover the cost. The CPT code of this procedure is, I'll try to pronounce that, 41899, and the cost is 16,000. What is another option? Wow. So dental treatment would only be considered for injury to sound natural teeth or removal of sound natural teeth in preparation for other medical procedures covered by the policy. So the dental insurance under UH1 would not cover this procedure, right, Sean? Or on the plan, I guess.
I would say I do not have the expertise to know exactly what a CPT code is. I think your best bet is to make a phone call to UH1. It's helpful that you've got the procedure code and ask them if it's something that could be covered under one of the plans available. That would be my best advice. That way you're educated going into it, knowing what your cost is going to be.
Yeah, the CPT code is usually what the provider submits after the service was rendered. So in this case, it would be very helpful. You call
Right.
The insurance company or UH1 and they could give you the definite cost around it, or if there's a discount that would be applied.
Can I speak to this simply because I used to manage a dental office?
Go ahead.
I'm just chiming in all over the
You
place.
are.
So it seems to me with a price like $16,000, this is probably a small child who needs to be put under anesthesia to have any services done. That would lead me to believe that there's likely going to be a hospital charge and a dental charge. So one would most
Cover the
likely be
medical.
billed
Yeah.
to the medical and one would be billed to the
Yeah.
dental.
That makes sense to me too.
Yeah.
Looks like someone has raised their hand.
Sarah,
Yep.
go ahead.
I was gonna ask for the dental coverage. There's like $50 deductible per person, and the preventive care plan pays 100%. So what are the preventive cares that we can get from dental, and what are the basic services?
I think on a high level, you could say your preventive services are going to be the routine cleanings and your x-rays. And then basic services are going to be simple fillings, teeth extractions along those lines. And the major services would be considered crowns, root canals, oral surgery, those high level services.
So here, like for major services, plan pays 15% after 6-month waiting period. What does it mean exactly?
It means to protect the plan and to keep your costs low, we're going to have you wait on the plan for 6 months. You have to have been covered on the plan for at least 6 months before the benefits are going to pick up. So if you have the services done before those 6 months, you've been on the plan for 6 months, you'll be responsible for the full cost.
And after 6 months, only plan gonna pay 15% of it?
Yes, those major services I think are laid out on there. They do vary depending on the plan, but I think one of them, you're right, is 15%.
So for major services, it's mostly on us. We have to pay it. Doesn't matter if we have like insurance or not.
Yeah, the insurance is going to pick up some, but you're right, the majority of the costs will be on the student just because, these are trying to keep the plans affordable for students.
Okay, but it's kind of like not beneficial. Is there like any services that would have like better coverage in the like major services?
Let's see. I've got this. I keep looking over here. I've got my little cheat sheet up.
There's
So-
probably a more comprehensive plan that has a higher percentage of coverage on those major. And that's where you would have to just explore all the options.
Yeah, for sure. It's you know, to keep the costs low for the majority of students to be able to afford them. We're looking at paying, you know, those preventative services you can go and have done for no cost. And then the basic services are being paid, you know, generously, but the major services are pretty low to keep the plans affordable.
Got it. Thank you so much.
Yeah, absolutely.
The last question regarding dental bridge issues, I need to make for my teeth for 2 bridges. I could not, since no coverage for this under UnitedHealthcare. Weren't quite sure on this question either. Not sure if they were needing a bridge or replacing a current bridge or.
That would be a major service for sure.
Yes, for sure.
It's like above and beyond crowns, so.
It's quite a process too.
And it is quite a process, and bridges in general are very expensive.
Yes.
I would guess if you're just replacing 1 tooth in a bridge, but this person has 2, replacing 1 tooth in a bridge is probably $2,700 before insurance, but that would be considered major.
Yeah, it would be very similar to an implants. Why does medical insurance only cover pediatric dental and vision services? The schedule of benefits also lists the following dental and vision benefits. So your dental treatments, allowed amount after your deductible, and a routine adult vision for vision, limited to 1 eye exam. It's a $5 copay per visit. General questions. This is for you, Joanne.
Oh, okay.
Why do we not have access to a trainer? There are plenty of sports trainers at the SDC, so can graduate students go there to wrap a sprained ankle and look at other sports injuries instead of needing to pay for a hospital?
That would be lovely. Employees don't have that option either. Why don't they have access to a trainer? If they were an athlete, they would have access to a trainer.
I think they're asking, why do all students have access to a trainer, maybe versus just athletes?
Yeah.
That's what it sounds like.
That's a really good question.
I mean, we're not currently set up to do that. We could explore that potentially, but I don't quite know what that would look like, so.
Yeah.
Something we can explore.
Okay, how do copays, deductibles, and coinsurance work? Within the UnitedHealthcare Student Resources website, there's a video page that outlines the deductibles, coinsurance, and copays. And then the student can also reach out to customer service to explore that as well. And then I do have some slides that walk through each of those examples. Okay, so here's the deductible example. So your plan currently is $150 deductible. So the student falls down the stairs and is taken to the hospital by ambulance. The student has not paid anything toward the deductible. So the student is responsible for the first $150 of the $600 total cost. Then the student is responsible for paying the 20% of the remaining bill. So your ambulance service is $600. Your deductible is $150. That remaining balance is $450 times the 20% coinsurance. So the student pays the 20%, which is $90. UnitedHealthcare would pay $360. So your total cost would be your $150 deductible plus the 20% of $90, and your total cost is $240. Question? Does that make sense?
Excuse me.
Yes.
So if we had an injury and someone drives us to the hospital, will still our insurance cover our cost, or do we have to go with ambulance?
No, you do not have to go with the ambulance. No.
Okay, thank you.
And in that case, it would just be whatever services you had at the hospital or the doctor's office. So whatever that 600 would be a different amount based on that.
Yep, got it. Thank you.
The out-of-pocket maximum, your plan,
Before you move on.
sure.
Andrew, if it was a different service that was less than 150, let's say it was $100, whatever it is, does it mean insurance is not gonna come in that scenario, or?
No, it will not. You will just pay that amount. And if it's $100, then you still have $50 toward your deductible to pay for the next
Oh,
injury or whatever.
So the deductible rolls over for the entire plan year,
Yes,
correct?
yes.
So if you had your $100 incident, and then you had the $600 incident, then the deductible for the second incident would be only $50
Right, yep,
basically.
right.
Okay.
Okay. So same scenario, the student falls down the steps, seriously damaging his knee, his or her knee, and will need extensive surgery. The surgery will cost around $15,000, and the student's coinsurance is 20%. In this case, the student has already met the $150 deductible. So surgery is $15,000, deductible $0. Your out-of-pocket maximum is $5,000. The student pays 20%, which is $3,000. And UnitedHealthcare would pay $12,000. So your total cost is $3,000. The $3,000 for this scenario plus the $90 from the incident before. Your total student out-of-pocket maximum is at $3,090 minus your $5,000, so you still have $1,900 remaining in your out-of-pocket. So once that out-of-pocket balance is used up, then all other incidents throughout the rest of the year are covered at 100%.
Where does the 90 come from?
Right here. The 20% that you paid on this incident goes towards your out-of-pocket as well.
Oh, okay, okay.
So deductible does not go towards out-of-pocket.
No. Coinsurance. So you're hospitalized for an injury. The hospital stay costs $1,000. You've already paid the $150 deductible. You have 20% coinsurance for the remaining balance. So your out-of-pocket is at $5,000. Your 20% of the $1,000 is $200. UHC would pay $800. Your total cost is $200. That $200 plus the $90 plus the previous $3,000 is applied to your out-of-pocket. So in this case, now you have $1,700 remaining in your out-of-pocket. Questions? That all makes sense? And you can always call UnitedHealthcare customer service to go through this as well, or the video on the UHC link will provide the same thing.
Hi, I have a question here. I understand the scenario 1, 2, and 3. So my question is, for example, someone gets sick and they visited the doctors, and the doctors told them, okay, he's having some injury in the brain or something, he needs to do some tests, labs. So are the labs will fall into these types of scenario, like 20%, then 80%, 5,000, like 150 deductible? Are the labs are also covered like this, or for the labs the patient need to pay everything?
I think they would be covered under a regular illness, right, Loretta?
Yes.
Okay, thank you.
This just outlines your current plan, so shows your deductible, 150, 300 for family. Your out-of-pocket maximum is 5,000 and 10,000. Your co-insurance is 80% covered by UnitedHealthcare, 20% by you. Your preventative care services are 100%. Your office visit is $20. Mental health is $20 office visits. And then your prescription drugs are 10, 40, and 80.
I'm sorry, maybe I'm asking too many questions. So
Not at all. This is
again,
fun.
I have a question about, because I see the physician's office visit $20. I visited the doctor for a normal visit, like I was having a headache or something. It's just normal physician visit, and the total bill was $205, and they charged me $55. I thought it's $20 office visit, but then they charged me $55. So what did I do? What did I do wrong there?
Hard to say. I don't know, Loretta, do you have an answer for that?
It is kind of hard to say on that one, depending on if the provider was in network or out of network.
It's a Portage
And
Hospital. I visited the Portage Hospital, the upper the one located at
yes,
the
but
Michigan Tech SDC.
so was the provider in network that you had to go see, or was it out of
Yeah,
network? Because that's where those out of networks costs accumulate.
yeah, it's in network.
Okay.
Actually, most of the Michigan Tech students who used to go to the SDC Health Center, and they are in network. That's what I know
Were
at
you
least.
okay? So were you referred to a specialist or
No,
anything, or
no, just a
you just
normal
went to them
headache.
and they charged you? Okay, then if they charged you anything outside of that $20, then I would take a look at the bill and submit it to the claims department to do a reconciliation to see exactly why they charged you anything outside of what you were supposed to have been charged for.
That makes sense.
As
Thank
long
you.
as yes, as long as it's within network and they can
Okay.
explain it to you.
Okay.
Right.
Thank you.
Sorry, question before you go on. Can you go back to the last scenario? So if this person goes, has another visit to an out-of-network provider, how does the deductible work now? Is it going to pay up to 300, or is that going to, I mean, the one is already exhausted here, is it going to count in the out-of-network deductible?
Yeah, so your out-of-network deductible would apply in that case. Oops, where was it? There we go. Yes, so it would be a 300 until your $300 deductible is paid if you're seeing an out-of-network provider.
Okay, so the out-of-network deductible is, it accumulates as a separate statistic and not.
Yes, correct.
Oh, okay.
Okay. Some additional services provided through UnitedHealthcare Student Services. So the Healthiest You is a 24/7 doctor access, and this is through either the phone or a video through your computer or your phone. And I do have some handouts around that as well, to how to access that. Healthiest You also has a virtual counselor that you can access for any counseling services. And then here it describes it a little more and using the app as well. The handout I have also provides this information and how to set up the app. So you can do it in the privacy of your dorm. If in the middle of the night, if you have something come up, you can just go through the app or your phone, your computer, and access a doctor 24/7. And they can even prescribe medications too. UnitedHealthcare also offers 24/7 student assist. So it's a crisis support, providing consultation and support, financial and legal counseling, mediation services, a Living Well portal, and college life with direct access to experts for other conveniences and services. And then they also offer the global emergency services. And this is just a list of some of those key healthcare terms and their definitions, like the coinsurance, the copay. It's an FYI. That's everything. Any other questions?
I was gonna ask about copay and co-insurance, how they're different, so maybe I should just read it real quick.
Copay is what you are responsible for. Co-insurance is a shared responsibility between UnitedHealthcare and you.
Okay, so that will be specified for.
Yeah, so that's where the 20% you're responsible for, and then UHC 80%. That's your co-insurance.
Okay, so the copay was not there in the scenarios, though, right? The scenarios you gave us?
No.
Okay, so it would be
But-
specified for every
yeah.
particular service,
But
or,
the copay is like your physician office visit, that you pay the $20.
Okay.
That's your copay, what you pay up front.
Hi, I have a question.
Okay,
So I got here, I started my PhD in January, and I need to like register that I have diabetes for the insurance to cover that. How is the process for that?
I'll refer that to Loretta.
Okay, so I'm sorry, can you repeat that? You said
Sure.
that you
Yeah, so I have diabetes and I would need to like register or have someone here to give my doctor's letters stating that I have type 2 diabetes and everything and my medication for the insurance to cover it. And I would like to know how should I do that process?
So with that, with the paperwork from your doctor, I would submit that along with the visit itself to the claims department so they can bill that correctly to let them know that you do have that diabetes.
Okay, but do I have to have someone here to check me, maybe some blood test, or just like the letter from my doctor is enough?
So you can actually go and get tested, or if you do have that letter from your doctor itself, you can submit it along with the, you can just submit it to the claims department so that they can know about your health condition to get it covered under the insurance.
Okay, the claims department is where?
It's actually through the UnitedHealthcare Student Resources, the customer service. It's
Okay.
one of the same.
Okay. Okay, thank you.
You're welcome.
Any other questions? I do have some handouts here for anyone that needs everything we've gone over today. There are some handouts that outlines some of the details. And always reach out to us. You can reach out to me or Loretta at UnitedHealth. Not Loretta herself, but through UnitedHealthcare customer service.
And also it would be great. I know that this video will be shared to us, so it would be great also if we get these PowerPoint slides because it's filled with information.
Yes.
Thank you.
I have them and toss them. I'll send them to you directly.
Okay, thank you.
Thanks, everyone.
Thank you.
Thank you.
Thank you.
Bye.
Here's some handouts up here. Anyone? It shows the